Let's discuss Qi stagnation with phlegm as a pattern in the depression. Clinical manifestations: depression, moodiness, uncomfortable feeling in the throat, like a foreign body that cannot be coughed up or swallowed, difficulty in swallowing, sighing, feeling of oppression in the chest, hypochondrial pain, premenstrual tension. Tongue, swollen body, possibly red sides, sticky coating. Pulse is wiry or slippery. The ethereal soul residing in the liver is responsible for ideas, projects, life dreams, aims, creativity. The ethereal soul provides this movement on a mental and psychic level to the mind, and for this reason, the ethereal soul is said to be the coming and going of the mind. When the ethereal soul does not come and go enough, the person lacks dreams, aims, projects, inspiration, and creativity. He or she lacks a sense of direction and feels frustrated. These people are often at crossroads, which may have to do with relationships or work in life, and lack a sense of direction. In short, the person is depressed. When qi stagnates over a long period of time, the free flow of qi in the triple burner is impaired, and this leads to impairment of metabolism of fluids. After time, this may result in the formation of phlegm. The coming and going of the ethereal soul may be restrained both by qi stagnation and by phlegm. Hence, the patient is depressed and lacks sense of direction in life. When, in addition to qi stagnation, there is phlegm, this clouds the mind's orifices, and it leads to a certain loss of insight. The person feels confused and bewildered without being able to pinpoint what the trouble is. On a physical level, the clinical manifestations are centered on the throat and chest, with a feeling of obstruction of the throat that comes and goes, and the feeling of tightness of the chest. The pattern of qi stagnation with phlegm is more common in patients between 35 and 45. It is usually due to sadness, grief, worry, or shame. Treatment principle: resolve phlegm, move qi, eliminate stagnation. Points: stomach 40, REN 12, bladder 20, spleen 9, spleen 6, P5, TB6, P6, liver 3, REN 17, REN 15, DO 21, DO 20. All are needled with reducing or even method, except for REN 12 and bladder 20, which should be reinforced to tonify the spleen. Stomach 40, REN 12, bladder 20, spleen 9, and spleen 6 resolve phlegm. In particular, stomach 40 resolves phlegm and calms the mind, and spleen 6 calms the mind. P5 resolves phlegm from the mind and opens the mind's orifices. TB6, P6, liver 3, and REN 17 move qi and calm the mind. TB6 is particularly indicated if there is hypochondrial pain. REN 15 and DO 21 open the mind's orifices and calm the mind. DO 20 lifts mood. Thank you for your attention.